Now, let me talk just a little bit about the topic of wasted doses. As you know, last week I spoke with you and there was a report about 1,000 or so wasted doses at the Pipkin site, and we corrected the record on that there were none last week. But I also said at the outset of this operation that I was the accountable person for every aspect of this operation. And so today I did want to talk in a little bit more detail about wasted doses and let you know that waste is a part of the process nationally. It's no less true here in Memphis and Shelby County. For the 435,000 plus doses that we've administered since we have begun this operation through the public pods, less than 100 doses have been either unused or wasted since we began. And all of those have been reported on a daily basis to the Tennessee Department of Health and to the higher authorities who are the issuing authority for that vaccine. Now, more than half of those doses are attributable to vials that have been cracked or broken, either in transport or as they were being moved from case to case. About another 30 to 40% of those are as a result of there was a lack of low dead space syringes. For the Pfizer vaccine, the federal government has said that we should extract 6 doses from every vial. Unless you have a low dead space syringe, you can only extract 5. Well, that one that you couldn't get out is called a wasted vaccine. And then the last reason is what I talked about last week. That is a dose that has been drawn into a vial and is unused at the end of the day. That occurred Saturday night at the Pipkin building, as we had 25 unused doses at the end of the day that are, quote, wasted. That is as a result, as you know, we shifted late last week to the first come, first serve model at the Pipkin building from 5 p.m. to 8 p.m. As we approached the end of the day, after administering almost 2,500 vaccines, our team overestimated the number of individuals who were coming through the line. As a result, we overdrew by about 70 vaccines. In other words, we ran out of clients and we had about 70 vaccines still to administer. So our team stayed at the Pipkin site until midnight trying to administer every one of those doses. They called upon the wait list that we have. We sent emails, social media blasts. We sent individuals to the universities that surround the fairground site. We sent people to Overton Square. We sent people downtown to several of the local establishments over in Cooper Young, and successfully got 45 people to come to the site and get vaccinated. But by midnight, we still had 25 doses that were unused, and therefore those are wasted. We discovered the error in the process in overestimation. We also corrected the process that allowed too many people to tell the pharmacist that they needed another dose. So all of those have been corrected. In the days following, we have had no other instances of that. But in fairness, I told you I'm accountable. I told you I would be the one that told you if that happened. And so that's what I'm doing here today to make sure that we all understand exactly what was going on with the process. So at the end of that day, it was very successful. More than 2,500 vaccinations delivered at the Pipkin site, and we continue to march on.